One of the most exciting new things that's coming down the pipeline in terms of non-operative sports medicine is the development and refinement of these regenerative medicine treatments, specifically figuring out exactly which patients benefit most from a PRP or a LIPOGEMS type injection and which patients don't necessarily do quite as well. One of the most common regenerative medicine treatments that we do nowadays, particularly for some of our athletes with tendinopathic problems, would be PRP or platelet-rich plasma. This basically involves drawing the blood from the patient, spinning it down to the platelet-rich fraction. The platelets effectively are the healing cells of the body. They undergo a process called degranulation, where they release a large number of growth factors in a very predictable curve. We use that growth factor surge to best heal patients with problems that don't necessarily heal well themselves, specifically tendinopathies in areas that don't have great blood flow. An example of this would be in the patellar tendon, for instance, the gluteal tendons, or in the lateral epicondyle. That's one of the more basic treatments that are done very commonly. This seems to have great effect in cases where physical therapy and other common treatments don't work quite as well. The other time when we typically use PRP is in cases where we're a little nervous to use steroid medicines. And as many folks are aware, steroid, while very effective in the shorter term, doesn't quite have great long-term outcomes, and in fact can be degenerative and can actually accelerate degenerative changes in joints and in tendons. So as a result, we use PRP in those instances to try to give some benefit without some of the degradative effects of the steroid medicine. One of the other things we do is something called bone marrow aspirate, and this is a related technique. It's sometimes referred to as a stem cell-like treatment. We draw blood from the iliac crest, typically, get a bone marrow aspirate, and we'll use it for its healing properties. This technique is commonly done in orthopedics, mostly in the OR. We've adapted its use in the office setting. The main focus here is to create a healing environment as best as we're able. The best treatments tend to be in more early arthritic conditions. In folks who are a little bit older, sometimes the bone marrow aspirate and the actual stem cell or growth factor curves from these patients aren't quite as high as we get older, and so we use some other treatments, specifically one of the newest ones being LIPOGEMS, which is a fat grafting technique. The rationale behind this is in the fat cells, the blood vessels which feed the fat cells have what are called pericytes, which live on those blood vessels. They actually are very effective in modulating local environments with growth factor manipulation. And the thought is that we use these pericytes and inject them into the areas of concern to try to kickstart a healing cascade.